guys, today we are going to discuss about prevention of Covid-19 with a renowned doctor, and his name is Dr. Mone Damodar. He is the Chief Medical Officer, Earth Hospital, Bangalore. He is an expert in curing spinal, neuro, muscular and neurovascular problems through combinations of Panchakarma and allied therapies of Marma. Dr. Damodar has cured hundreds of spinal issues since 2 decades. Let's discuss with Dr. Damodar. Welcome to you, sir.
Hi, Rohan. I've seen your channel on mKidsTV, and you're doing a fantastic job. Absolutely very dynamic and so enthusiastic kid you are. God bless you. And I'm very happy to join you on this session of discussion on COVID awareness. I'm very happy to share the discussion with you, and I wish channel, your mKidsTV, be helpful for many people who and all visit your site. I wish you make much more beautiful videos of these things, of awareness, and then social awareness, and then sporting things, and then whatnot, everything. Yeah, I've seen you on the many of your videos on mKidsTV.
Thank you, sir. Great to hear these words from you.
Guys, now we are going to start the interview, okay? So, the first question is, we are hearing coronavirus and COVID-19 for the first time. What is this all about?
Yeah, there are like thousands and lakhs of viruses on this planet. It's not like one planet or any specific virus which is there on the planet and which is causing the problem. There are like thousands and thousands of viruses on the planet. Now, see, what is causing the problem is viruses are all over around surrounding us also. But what happens is your defense system inside the body, the immunity. You know the immunity, isn't it? So immunity is a defense mechanism of the body which fights the infections or diseases or any trauma which happens to the body. I think you kids are much aware about immunity, isn't it?
Yes.
So now this coronavirus specifically is being found in the markets of, and the wet markets of, flesh markets of China. That was in Wuhan in the late year of 2019. That's on the December maybe. At Wuhan, they found December 2019, they found the first case of coronavirus that was tested positive for coronavirus, which affects straight away onto the respiratory tract. You know, the respiratory tract is your nose, your throat, is your lungs, and then you breathe, isn't it? So these are we call it as upper respiratory tract and lower respiratory tract. So these are the areas where usually this virus shelters, and then it thrives on the human body. So it is because it was identified as coronavirus. It's called, the disease which is caused by coronavirus is called as coronavirus disease, that is COVID. CO for corona, VI for virus, D for disease. So coronavirus disease is called COVID because it was identified or discovered in the late year of 2019. So the number 19 joins there. So COVID-19 is a disease name given to that particular disease. Yeah, COVID-19.
Now let's go to the second question. Do we really need to worry about this coronavirus?
Yeah, very much. You can see like a demon, it is like spread all over the planet, isn't it? It started happening somewhere in the corners of China, I mean the mid parts of China, somewhere in Wuhan. Nobody would have been aware about Wuhan, isn't it? So now it is like all over the planet. You know, like you have China, part of China was started affecting from late December, January, February. By February, much of places of China got affected, and by the time it has already spread its wings around parts of Europe already, isn't it? Italy, Spain, and then slowly it has occupied Germany, and then France, and then now you can see that in USA and Netherlands and UK, it's like it's showing its severity, isn't it? It's very, very dangerous because I'm not talking about the statistics here, but then you need to be very aware about it because your question was specifically about knowing why we need to be worried about COVID-19 because
Let's
it
go to
basically
the
yes, it acts on immunity of a system. Your immunity or any individual here immunity has to be uh, updated. I mean, like what they have to take care of the health, and their immunity should be of high priority. So only then they can fight this problem out, or else the pain which is caused by this disease is very, very immense.
Okay, doctor. Now let's go to the third question. Are there any medicines for curing the patients who are affected with this virus?
See, basically, there are like a lot of technology speaks everything, isn't it? Technology all over. There are like a lot of scientists around the planet who are working on this uh, for particular vaccine for these problems and all they are talking about. But there is no particular medicine which has been specifically given because this just came like a surprise, isn't it? Nobody would have expected like this one
Yes.
disease would come like that. Yeah, it just came up like that, and then everywhere what they are giving is just anti-malarial drugs also. But we, as a holistic healer in Ayurveda, we give more of immunomodulators. There are like beautiful medicines. In India, we have seen like surveys speak. The parts in Gujarat and parts of many parts of South India, they have already started using um, herbals for treating the isolated cases of COVID, and they have shown pretty well. The response have been pretty good. Actually, they have really the tests have been tested negative. So that says like you have beautiful medicines in Ayurveda. We can treat through Ayurveda.
Yes, doctor. Let's uh, let's go to the fourth question. We hear about the discharged patients, right? So, are these patients fully
Yes,
recovered?
they are recovered. They are recovered. I mean, like hats off to those people who have come out and then may let them because it's very difficult. Once they have come out, they have built up their immunity to fight this disease. So I think they are recovered. But then you don't know because the incubation period of this incubation, you know what is incubation? Incubation means the the time of a body's invasion into the body till it shows its first symptoms inside the body. Like the person has got, for example, I tell you, if he has gone and attracted to one contact in the sense he goes and uh, gets in touch with the person who has already been attracted with COVID, and this person he gets attracted to it, and then he gets first lodged with COVID virus inside, and then from then on they say there's 14 days of incubation, but just now it is like even after 28 days also people are showing the symptoms after 28 days. So it's very indefinite to say what exactly is the incubation period of this disease, and everybody's immunity is unique. So some people just show the recovery very fast, some people show very slow, and then yeah, I mean as you see usually it's like intermittent fevers and then like whooping cough, I mean like very driving hard fought cough. You have to be very careful about it. So it is very indifferent to say this answer for this question, but then they have developed that immunity already to that. I don't think so they'll be suffering with that problem again until
Okay.
they do not come in contact with again.
If, so the fifth question is also related to this. If the patients are fully recovered, it means that we have
Yes,
found the medicines for this virus. Then why do we need to worry?
it's better to be like sensible, isn't it? Why do you want to go yourself and to land into that problem? Because there are certain people they feel like it's not that very specifically we need to be worried about, but then it's like a mass spreading thing, isn't it? It just can spread within seconds. As little droplets from the mouth can just spread to any person like that, and then because of you might not suffer too much, but then you can be transferring. You can transfer to the people who can whose immunity is very less, and they will be. It can be very fatal for them, and they can die because of that. So why do you want to lodge yourself into that kind of problem, isn't it? So it is better you stay away from these kind of problems, taking essential care about your own self. So it's better. You shall not be a carrier for some problem like that.
Okay. The sixth question now. What kind of symptoms does these COVID patients show?
The first symptom they show is like dry throat, and the intermittent fever, and which does
Okay.
not come down at all. And then you had difficulty in breathing. Difficulty in breathing in the sense even like you have no idea about the pain what COVID patient goes through. And it accumulates almost all parts of respiratory tract. So it is literally like it will be condensing the lungs. I mean, restricting your lungs to expand. So it's literally you have to breathe out your lungs out. So it will be like very difficulty in breathing. So, and then weakness, terrific weakness and muscle pain. So these are
Yes.
certain symptoms of COVID.
Yes, doctor. How can we prevent ourselves from getting affected with this virus?
See, God has given you a beautiful weapon within your own self, immunity. Isn't it? You know about immunity, isn't it? I hope you know that. This immunity is the one which usually helps out to defend the body from any kind of infection to the body. So we have to keep our practices very regular. You have to exercise out. You have to see that all the toxins which have been accumulated in the body, they drain out very regularly. And then you keep your health level to the ultimate level, health state to the ultimate level. So for that to do, you have to exercise daily, and then you have to keep your immune system to the top state. If you're not exercising, then you might be prone for this problem. But maybe once it is attracted, the best, I mean, to be better, to be away from this thing, you do essential pranayams. In Ayurveda, we practice pranayams. Pranayams are the best way of keeping your respiratory tract much more immune. So we do pranayams, we do yogasanas, and we do sudarshan kriyas, and very regularly we do padmasanas and all.
Meditations?
Meditations, yeah, it does help to keep yourself calm rather than not to panic too much. But then it's better to exercise your body with the little stretches so that you don't feel that muscle pains or anything like that, and then you keep your immune system to the top state.
Okay, yes, doctor. Also, we hear many times during this period to stay home. And we are also home-based learning. Why do we need to stay at home?
I'll take this question as two parts. The first thing what you said was stay at home. Stay at home is very important. You need to be sensible first, isn't it? You don't want to go and then spread the problem like, it's better to be sensible rather than go outside this, because this problem can spread like anything. A mere touch from one person to other also is enough. A small dialogue with your close friend is also enough. That's why they say, irrespective of how close they are, the relatives, you keep yourself away from them. So knowingly or unknowingly, we don't know how we get in contact with them. So rather than repenting, it's better to stay back. Hope you got the question.
Yes, doctor.
It's like you don't want to get into that kind of murky situation of attracting the disease, and then you be one more vehicle at the home, you spread to others at home. Not good, no. Does it feel good?
No.
No, isn't it?
Now the ninth
second question. You said, no, come wait. I have to answer your second question. You said like home-based learning.
Yeah.
Something is better than nothing, isn't it? You're not able to go to school.
Yes, doctor.
So you don't have any other way. I mean, you have to stay back, and then there's the only way out. I mean, you have to get in touch with your teachers, and like it's a nice point, nice question. I like that question actually, because you kids at this point of time, interactive. You have to be much more interactive with the teachers and all. I mean, it's important to get in touch with the teachers, get your questions cleared, get your doubts cleared, and start working at home so that you don't feel the difference between going to school or going working from home or studying at home. So it depends, like, people who do not have much of technology, I don't know how about them, but then we have beautiful habits in India. We have, like, home gardening. You can do some pranayams. You can do some stretches, some activities, isn't it? So by that way, you can really develop your immunity that way. And then home-based learning, you have to get in touch with your teachers very regularly so they can solve their problems with your friends. You can get in touch with friends through phone, online, isn't it? Everything is possible by phone.
Yes, doctor. Now let's go to the 10th question. Does the coronavirus spread to the kind of meat that we eat?
Come again, I couldn't get you.
Does this coronavirus spread to the meat that we eat?
Meat?
Yeah.
Ah, okay. Possible. It depends upon the place where they have taken. But in India, we have not really seen the cases where you see, but not necessarily by meat alone. Just like small droplet itself is enough. Meat itself is not alone one vehicle for COVID or coronavirus. It can just spread with any other vehicle. It can happen by vegetables. It can happen by a touch. It can happen by any other groceries you're taking from departmental store.
Yes, doctor.
The only one thing is you have to sanitize everything, wash everything, and before you use it. That much only.
Yes, doctor. The 11th question is, how long you might think that the vaccine can be found for this coronavirus?
No idea, isn't it? They are working about it, but then
because some
world
people
has
say,
been very
some
world
people
has been very successful in clearing many of the problems like measles, diphtheria, chickenpox, smallpox. You have many vaccines which have been come into this planet, and we have been successful in clearing the problems. But this is one disease. I don't think so. It will be that easy to develop a vaccine for this thing. Before that thing, I think a human being, he can himself develop a better immunity. Because what we need to understand is one thing called as herd immunity. Recent times they are talking about one this called as herd immunity, HERD. You get that, herd immunity. Herd immunity is the one which has to be, which is caused by the group indulging with the people who have already suffered and recovered, and they're getting into social activities. So that kind of immunity, I think that's the only one possibility that I feel can be a solution for this.
The 12th question is, are there any other viruses like coronavirus that we need to worry about?
Why should we worry about some other virus in this place?
Yeah,
I mean, it's better to be,
because we need to be with both, like on coronavirus and some other virus. Like we have lots of work. We need to find vaccine for this one. We need to find the vaccine for that one.
Yes. Yeah, they have seen a couple of viruses, isn't it? A couple of months back, they have seen Nipah virus at Kerala. They have seen Ebola virus at Africa, and then like a lot of viruses, and they're like,
even like
they are just come and gone. Yeah, SARS. This COVID is also one of the things which affects the SARS. I mean, like it's called as SARS. I mean, severe acute respiratory syndrome. The SARS.
Why should we wash our hands frequently, wear masks, and should not touch our faces?
Sanitization, very important, isn't it? You don't want to.
Yes, doctor.
Okay. You don't want to get into that kind of problem of becoming a carrier for this problem. So sanitization is very important. The first thing after social distancing, we talk about taking care is after social distancing, sanitization. Very, very important. You should have your own mask, and you should frequently wash your mask. And then foment it, and then take essential measures to keep it fomented, and then use your own mask. Use your own mask, and then take essential care of washing your hands very regularly, around like every time you go outside, or you feel that you have gone outside, you have touched something, you have to sanitize yourself, because this particular virus can spread through anything, through touch.
Yes, doctor.
Yes.
Even you to audience.
One thing I would like to talk about, the best thing what you can do at home. The best medicine is there at your own kitchen itself. You ask Amma. Amma will help you find the medicine for all your respiratory tract problems. The best thing what in India what we use is tulasi, what we call it as holy basil. You heard about it, tulasi?
Yes, doctor.
Tulasi is one thing, and then one more medicine actually. You Google it out. You will find it. It's called heart-shaped moon seed. Say heart-shaped moon seed. We call it as guduchi, amrita in Sanskrit.
Yes, doctor.
Very, very effective in this problem. So apart from this thing, you have cinnamon, you have clove, you have black pepper. You ask Amma at home, she can prepare a good decoction for these things. This has been a very, very effective, Rohan. Very effective. You tell Amma, she can prepare a beautiful potion. I mean, like very effective remedy for any upper respiratory problems. And in fact, to be away from to get attracted to this problem, here in our ministry, our Ayush ministry in India, they have proposed this decoction which has to be prepared with this heart-shaped moon seed, and then tulasi, cumin, cardamom, cinnamon, clove and black pepper. The potion or the decoction which is prepared out of these things is very effective. Make note of it. It can be very helpful for your friends.
Yes. Even you two guys follow these safety measures, okay? And take care of this virus. It is very dangerous. Okay. Now, the 14th question is, how can Ayurvedic help in preventing coronavirus?
I just said you about it, isn't it? The first thing, in Ayurveda speaks about swasthya swasa rakshana maturasya vikara prashamanam. It says like maintaining the health in the healthy individuals is the duty of Ayurveda. Ayurveda takes up in teaching the people to keep themselves healthy first, and then it teaches the people to overcome the diseases. So we give utmost importance for lifestyle diseases. We give importance in teaching the people about their lifestyles. We tell them when to eat, when to brush, what to do, what kind of activities to be done according to their body constitution. So Ayurveda is like a unique science. It's a unique science, and then it's not just like a medical science which gives like medicines, and then you take this medicine, this miracle medicine, this will treat your problem. No, it's not like that. Ayurveda teaches everyone in this unique way.
Yes,
so it's
doctor.
about life science. It's not just a medical science.
Yes. And last but not least, the last question: how can our grandparents and our friends should take care?
Very, very important, isn't it? Yeah, because immunity in little old people might be little less, and there are like miracle people. I mean, people who have come out of this problem very effectively. You have 90-year-old people, 104-year-old granny who have fought this problem, and effectively she was treated for COVID. So, but you need to be very careful. The people who are suffering with diabetes, people who suffer with asthma, difficulty in breathing, or much old people who did not have much of physical activities, their immunities will be much more lesser, and they might be prone, or it can be very dangerous for those people. So you need to take care of them very carefully, sanitize them very frequently, give them essential needs from time to time. You give fruits, and then citrus fruits, I mean like vitamin C, essential vitamin C had to be supplemented more to the old people, and not just old people. I mean, for everyone at home. So that is one thing what you have to take care, and then teach, educate the people in and around and within your close vicinity. Tell about the effectivity. I mean, like their lifestyle, how it has to be to keep yourself. A person who does not uh, do the physical activities, who do not have the proper food style, their lifestyle is not that good, then they will definitely suffer. The people who exercise regularly will never ever suffer these problems. Take my word.
Yes, doctor.
Guys, if you like this video, please subscribe, share it, and then bell button on the top over there, and then thumbs up over here. Bye bye.